Hello and welcome to Cecil.tv, Cecil Weekly. I'm your host, Rob Churnside, and it's April 3rd. We have the pleasure tonight of having my former boss, Cecil County's Health Officer, Stephanie Garrity. Stephanie, welcome to Cecil.tv.
It's good to see you again, Rob.
It's good to see you. Now, I know you're a health officer. I know what the health department does because I worked there for many years. And I also know that our former boss, Dr. Virginia Bailey, at one time said that public health functions best when people don't even realize we're working. That's been a few years and things have changed vis-a-vis the mission and the duties of public health. Tell us a little bit about that.
Sure. Our vision remains healthy people, healthy community, healthy future. That hasn't changed since Dr. Bailey's tenure. And our mission remains the same too. We need to continue to work to improve the health of Cecil County, but we can only do it in partnership with the community. We can't do it by ourselves. And we do that by providing leadership to find solutions to our health problems and developing policy and programs to fill gaps and making sure that we have quality health services in the community for everybody. Now that's very similar to the health department's mission years ago. But things have changed a little bit with the introduction of the Affordable Care Act, also known as Obamacare. More people are insured now, and whereas in the past local health departments were direct service providers, that's changed for us. We're becoming less of a direct service provider and more of a planner, strategic planner, convener, building partnerships, seeking new funding, new programming, and things like that.
Right, right. And what exactly is your role in all of this?
Sure. Okay. I've been thinking about this a little bit and trying to articulate it in my mind, and I think concisely I can say I lead a very, very dedicated cadre of public health workers and professionals. I think it's my job to create and nurture partnerships, which I mentioned before is critical to doing any kind of health improvement activity. I think I'm responsible to make sure that the taxpayers' dollars are wisely spent. And I think I'm also responsible for making sure that we offer quality programming and that we track the performance of that program, because I don't want to put money into a program that's not effective.
Right.
That's not good use of taxpayer money. And finally, I think it's my responsibility to ensure that health department staff give great customer service.
Right. And
that's my job.
That's a big job.
It is a big job.
That's a big job. And I know from experience you do a great job.
Thank you so much.
Your highest priorities at present.
Okay. Our highest priorities have been created by our Community Health Advisory Committee, which is made up of professionals from agencies representing the health community, as well as community-minded citizens who are very interested in public health activity. And they meet several times a year, review data, review need, and come up with priorities. And we have 3 priorities that we are looking to work on now. And the first is probably no surprise to your TV audience, expanding access to substance use disorder services and mental health services. Our second priority is addressing chronic disease, particularly diabetes and heart disease and respiratory disease. Heart disease and respiratory disease are some of our biggest killers here in Cecil County. The third priority is something that we really haven't looked at before but need to really focus on, and that is social determinants of health. And what I mean by that is things like poverty and homelessness, which contribute to poor health outcomes.
Sure,
Yeah.
sure. And you've alluded to the opioid epidemic.
Yes.
A couple things that the health department is doing. You mentioned 2.
Yep.
Anything else that CCHD has an acronym?
We know it. Yeah. Yeah. Let me speak to that for just a moment, and maybe you can invite us back in the future to talk a little bit more broadly about some of the specifics we're doing in terms of the opioid crisis here in Cecil County. As you know, as we all know, this is a nationwide concern. Overdose deaths are a nationwide concern. And Cecil County has been for several years now trying to attack this problem using what we call a 4-pillar approach. The 4 pillars being prevention, treatment, recovery, celebrating recovery, as well as public safety. And all of those 4 pillars are supported by the community and partnerships that the health department has with community members to focus on this issue. I know we don't have a lot of time to go into detail today, but I do want to encourage your audience to go to our website, rewriteyourscript.org, which can provide a lot of the resources that the community may need to help them work on this issue. I don't know anybody in this community that hasn't been somewhat affected or personally affected by a family member who is struggling with substance use disorder.
Yes, indeed.
So
And
rewriteyourscript.org.
and that's good advice. And yes, the answer is yes, we would love to have you or representatives from the health department come back and
Great.
talk more broadly about
We
that.
would love to do that.
So now, a little bit of background about you.
Sure.
What did you do prior to becoming health officer?
Well, I worked for about 20 years in both the private sector and public sector in services for older adults. So that would be like senior centers and senior services, long-term care such as assisted living and nursing home care and the like.
Awesome.
And then I just happened to answer an ad in the newspaper, and I was hired as the county's first deputy health officer, and then got the nod to be the health officer. So here I am.
Happens quickly. I remember the whole deal.
It does happen very, very quickly. You're right.
And I also remember mentioning your name when at Upper Shore when they changed over somehow because they had a ping pong table they wanted to get rid of. And I took it to the sheltered workshop where I worked, and I was in heaven. I was getting paid to play ping pong. It's only 15 minutes a week,
That's
but
right.
still.
That's right.
Young guy,
your
that's a
job.
big deal.
That is a big deal. Yeah, that's a big deal.
Well, Public Health Week.
Yeah.
What's going on with that, and what's in it for the public?
Okay, well, nationally, every year, the first full week in April is National Public Health Week, where local health departments, state health departments, and the nation in general help to celebrate the advances that public health has made over the years, and to celebrate the employees that continue to work in public health. This week at Cecil County Health Department, we are celebrating our workforce by offering some activities and some opportunities for trainings and the like to focus on continuing to improve on what we do. So
Awesome.
Very important, yeah.
And that recharges the public health employees? And
I hope so. It recharges me, gets me into the groove, and gets me feisty and ready to go to fight another battle on behalf of public health.
And they're out there.
And they are. And they are.
And the public appreciates it. I know I appreciate it. And I thank you for coming on Cecil.tv.
Thank you. Can I say one more thing?
Yes.
I would also encourage the public to visit our website, cecilcountyhealth.org, to find out a little bit more about what we do. And I would be remiss if I did not mention, because the public would be very interested in this, our upcoming rabies vaccination clinics for the month of May. May I do that?
Please.
Okay. Saturday, May the 6th at Cecil County Health Department from 9 to 12. And also Saturday, May the 13th from 9 till 12 at Water Witch Fire Company on Tome Highway. More information will be on our website, but I really needed to say that. The cost is $7 per animal, per vaccination. We try and keep that price very, very low for obvious reasons. And come on out and have fun, meet some friends and animals, and get your animal vaccinated.
Just might bring my pups out.
That's great.
Thanks. Again, Stephanie, thank you.
You're welcome. Rob, good to see you again.